Good evening, everyone, and welcome for today's Med Talk by IJCP. I am Ada, your host for today's important and insightful session. This afternoon, we are addressing a topic that often remains unspoken yet is crucial for public health and awareness, breaking the silence, the signs and stigma of genital herpes. Joining us is a highly respected expert in infectious diseases, Dr. Uday Kumar Jadhav. He did MBBS, CHIV, PDCR, AFIH, infectious disease consultant, and in charge of the Arts Center at LNT MDACS in Mumbai. He is also the owner of Life Care Clinic, Total Care in HIV/AIDS, and it associated with Panacea Super Specialty Hospital and Shraddha Hospital and Critical Care in Aurangabad. A very warm welcome to you, Dr. Jadhav, sir. It's truly a pleasure to have you with us today on Med Talks by IGCP. Today's discussion focuses on both the scientific understanding and the social perspective, aiming to replace fear with facts and stigma with sensitivity. Sir, you can may proceed now. Thank you.
Thank you very much, Ada. Can I have my slides, please? Good evening, everybody. I am going to talk on the breaking the silence, the science and stigma of the genital herpes. I am Dr. Uday Kumar Jadhav, infectious disease consultant. My dear friends, we all know that herpes is one of the most common virus infection that we see in the community, yet the most ignored and underdiagnosed. As we know, we talk regarding all the genital herpes and the proper way in which we should understand it. This would help us in communication and also counseling strategies and also diagnosing it. So at the end of this study, we'll learn see the virology, epidemiology, and the natural history. Also to understand the link with HIV and other STIs. So, what is genital herpes? The herpes is an infection which is seen in the genital area. It is caused typically by the herpes simplex virus type 2 and increasingly by herpes simplex virus type 1 in sexual or orogenital contact. It is a lifelong latent infection. It means with periodic intervals, there is reactivation and also possible shedding of the virus even in the absence of symptoms. So, mostly recognized as a sexually transmitted infection, though underdiagnosed because many infections are asymptomatic or under recognized or unrecognized. So, what exactly is the structure and key points that help to spread this herpes simplex virus? The herpes simplex virus it enters via the mucosal surfaces of the skin and it breaks it under the skin, moves to the sensory ganglion. And after moving to sensory ganglion, it establishes its latency. Upon establishing itself in the area, there is a reactivation. This reactivation it travels back to the skin or the mucous surface lesions, and there is viral shedding. The shading can occur without visible lesions, which is also called as asymptomatic shading, and also is an important point for transmission. Distinction HSV2 traditionally is seen in genital region and HSV1 traditionally in oral, but epidemiology is always changing because there is always a shift and phenomenon. As we know, the reactivation can happen in lot of times under stress due to conditions of hypersexuality or under the influence of alcohol or lot of travel. So, what are the major risk factors by which the virus is transmitted? The number one part is via skin to skin contact during vaginal or anal or oral sex. The contact with infected secretions or lesions. Also, there is a lot of time asymptomatic shading, means the transmission possibly where there are no source are visible. The risk factors, which include wild transmission of this type of virus, is having multiple sexual partners, or early age of sexual debut, or unprotected sex, or coexisting sexually transmitted infections, and the most often the HIV infection. Lot of patients with having the HIV are predisposed by having herpes simplex infection. Whenever we take a history and ask in a local language, were you suffering from symptoms of herpes simplex virus? The answer is generally yes. So as the times are changing, the people are becoming more and more vulnerable. Lot of people are infected or exposed to herpes simplex virus. Yes, there is a biological vulnerability. Women at higher risk due to genital anatomy and mucosal exposure. Let's look at the global figures. According to WHO, the estimates of 2024 suggest that there are 846 million people aged between the age of 15 to 49 who live with genital herpes globally. That is, more than 1 in 5 people are having active genital herpes infection. In 2021, 35.8 million new incident cases among 15 to 49 years age group were found globally. This is increasing. The raised rate of increase is corresponding to lot of people going for unprotected sex, lot of special groups which are more exposed to unprotected sex, anal sex, and also orogenital sex. The incidence rates globally have remained relatively stable, but absolute number rising because of the population growth and rates rising in some region, that is example Southeast Asia, due to frequent tourism activities in these areas. What about the epidemiology in our country? As we know, India is the hub of the youngest population, and these youngest population are exposed to the internet era. Now, as we are now in the 5G age, lot of people are connected, and due to more and more interaction with other people and having groups like LGBTQ and also other infections in the data are more and more. Now, if you go for STD clinics, the prevalence or seroprevalence HSV2 is found. Attendees from 43% to 83%. So there is a huge number. Most common symptoms of people visiting a STD clinic is HSV2. Some recent study has shown that the general Indian population of 10% is extended or is more approved of having HSV2. So a country of 140 crores people, who 10% means 14 crores of people are having HSV2. Another study is in migrant where main indicated HSV1 48% and HSV2 3.7% among Indian men living abroad. Implication is that significant burden, though under-recognized, public health programs may not always emphasize herpes as strongly as HIV or STIs. But, my dear friends, HSV2 is a strong hold in getting other STIs because this is the foremost infection that is commonly seen in the population. Reasons being high temperature, reasons being poor hygiene, reasons being having multiple sexual partners. So let's come to the clinical presentation and what are the primary episodes. So many primary infections are asymptomatic or minimally symptomatic. So people they don't get it and they just ignore it, having some kind of skin infection. When symptomatic, painful genital or perianal vesicles like ulcers may be associated with systemic features like fever or malaise or lymphadenopathy. These are usually seen. The duration healing may take longer in primary infection. Risk of virus shedding is higher early on. So this happens, and when this happens, there can be herpes labialis or herpes genitalis. So, what is the clinical presentation? Most commonly, recurrence and shedding are commonly seen with this effect. So, a lot of time, herpes simplex virus 2, the median is 5 recurrences in first year, and in few recurrences in the first year in US data. Lesions appear less severe but still recurrent. Shedding may occur even without lesions. So sites are genital area, perianal area, buttocks, thighs, depends on contact, important for awareness. Complications and special population. So newborn or neonatal herpes, risk of transmission during childbirth if mother has primary or active infection near delivery. It can lead to severe disease. Even immunocompromised, like that is, people living with HIV/AIDS, more frequent and severe outbreaks, higher risk of transmission is seen. Psychological or quality of life do impact that should be covered in the newer details. More commonly in the age of LGBT, the poor economic condition and lot of higher sexual practices is the more reason for this. Genital herpes is also linked with HIV and STI linkages. The herpes simplex 2 infection increases the risk of acquiring HIV. It is almost 2 to 3 folds because of mucosal disruption and inflammation. Also, co-infection with HV outbreak may facilitate HIV transmission, which also can add STI in that. The implications are addressing genital herpes is a part of broader sexual health and HIV prevention. In impaired immunity, we see there is altered frequency, natural history, susceptibility to STI, and with HIV, there is a more enhanced transmission, and it can progress to the clinical disease. Most common is the unprotected sex in intercourse. Now, how should we diagnose herpes simplex? It can be diagnosed clinically with typical lesions plus history, but many cases are atypical or asymptomatic. We can also have laboratory confirmation, which is done with the PCR palm lesion, which is a swab that is taken and differentiating herpes simplex 1 with HSV2. Serology type specific antibody can be helped but has limitations. Routine screening of asymptomatic persons not generally recommended, but many guidelines. But your focus should be on symptomatic, pregnant, or high risk contexts. Now, how do we manage this particular type of infection? This is managed by antiviral therapy. The first line antivirals are acyclovir, valacyclovir, famiciclovir, or symptomatic episodes. For recurrent diseases like episodic therapy or suppressive therapy, depending on the frequency, severity, or partner risk, should be done. Suppressive therapy can reduce outburst frequency, reduce asymptomatic shedding, and reduce transmission risk. In India, we use acyclovir 1 gram twice daily for 3 days, which is found effective in one perspective articles. Now, how should we prevent this? The preventive strategy is only with condoms. Condoms act as a barrier contraceptive. They reduce the risk but does not eliminate the risk because skin to skin contact of areas is not covered. Avoid sexual contact during visible outbreaks or prodromal symptoms. Partner disclosure, counseling, and informed decision making should be done. For pregnant women, management of herpes to reduce neonatal risk. Consider herpes to reduce. Consider cesarean delivery if active lesions are at delivery. Consider partner testing, education, and reducing number of sexual partners. Need for vaccine development that is there, but we do not have a vaccine for herpes. We should also see that the public health burden and economic impact that is there and most of the time it is not life threatening, but it is of lifelong nature, recurrence, transmission risk, and stigma impose a psychosocial, rational, relational, and economic burden. We should focus on adult sex health, STI programs, and linkages with the HIV program, make them relevant for public health policy and resources. The core or crux of this talk is to reduce the stigma of genital herpes. What we know is that stigma should be defined. There are negative beliefs, there are attitudes and behaviors toward persons with herpes. A validated genital herpes stigma scale identified four factors. Number one, personalized stigma, there is disclosure concern, the negative self-image, and concern with the public attitudes. The research indicates that people with genital herpes rate is just below HIV in the potential reputational damage. Because many people are asymptomatic or unaware, lack of disclosure combined with stigma leads to isolation, anxiety, poor mental health, and avoidance of treatment or communication. So we should understand the quality of life and psychosocial impacts have this. So if there is a person with herpes simplex, people may have psychological distress, feeling of shame, fear, rejection, anxiety of transmission, etc., low self-esteem. It also have impact on relationship. There can be disclosure challenges. A wife may feel cheated if her husband has herpes simplex, and there will feel that if he has gone to other woman or other partner, there can be fear of intimacy. There can be difficulty partner communication, etc. Also, there can be recurrence in frequency. They can also have other outbreaks. And underreporting, undersupported, many persons with genital herpes may not seek help or support because of stigma, leading to worse outcomes. So, how should you break this? To break the silence, the only thing here is communication and counseling. So, we need to create safe spaces for discussion. We should give emphasis on herpes as common, manageable, and part of sexual health. The clinician led counseling using non judgmental language provide clear information about transmission, management, prevention, encourage partner communication, and informed decision making, provide psychosocial support or refer when needed, example support groups, peer networks. Also, public health messaging, including herpes in broader STI, HIV prevention campaigns, normalize it, reduce fear and shame. So we should have policies to integrate this education or the public strategies, and this can be helping us to get the keep challenges and gaps. So underreporting and lack of routine surveillance for genital herpes, and also many infections which are asymptomatic, which are hidden. There is a hidden transmission, difficulty in prevention. Also, no vaccine is there. Also, stigma remains a strong barrier to care, disclosure, and open communication. Limited data from many low middle income countries, including India, on herpes. We need for integrated programs linking herpes with HIV STI services. So anybody who has a kind of infection on the glands, on the genital area, should report it, should take benefit of counseling. This is one of the case that I got. In this case, a 30-year male who is sexually active tested positive for herpes simplex antibodies. There are no symptoms at present. The question is, does he need antiviral treatment? What should be our advice? These are something we got, and from this, you see the IgG is positive, IgM is negative, and as we know, IgG doesn't have anything. In the current infection, if the person is having IgG, that means the antibodies are high, that is immunity power is high, so it doesn't need any kind of treatment. So, to summarize this, genital herpes is highly prevalent, lifelong, and short in and has an important individual as well as public health implications. We should understand the virology, the transmission, and the challenges in that. Also, stigma is a major barrier to diagnosis and disclosure. Any person, a patient or person having kind of infection in the genital area should take help of a doctor. There should be a call to action with the clinicians, public health professionals, and the communities together can break the silence. Otherwise, we will have a higher frequency of herpes simplex in our community, which can be an epidemic. So, final take home message: due to constraint of time, many people have herpes and may not know it. We should normalize the condition. Communication is the key with patients, partners within health system. Prevention and management exist. Behavioral biomedical counseling intervention is there. We should address the stigma, which is important, and we should strengthen public health approaches, surveillance, integration, research, and awareness. Thank you very much, friends. If you have any questions, you can tell me now.
Thank you so much, sir, Doctor, for that detailed and insightful overview, sir. That's truly helped us understand the condition both medically and socially, sir. Let's now move ahead to a few questions to explore this topic in more depth, sir.
Yeah, thank
Okay. So the first question we receive, to start with, doctor, could you please explain what genital herpes is and how it differs from other sexually transmitted infection in terms of symptoms and transmission?
Yeah, actually, genital herpes is a two types of infection is there. One is asymptomatic, that there can be some kind of there can no kind of infection, there can be no kind of symptoms. The person can have genital herpes. It is a viral infection. When it is symptomatic, there are kind of ulcers or blisters on the genital area, both male and female. These ulcers can grow. These ulcers can then shed the virus, which can be transmitted by skin contact from one person to another during the act of sex. This particular infection can be treated. To treat that, we need to go to a doctor, to a clinician. If anybody is having kind of signs or symptoms of herpes simplex, we should visit a doctor. Most of the times in Indian community or general population, we say garmi ho gayi hai, and that garmi is misunderstood. Garmi is a kind of viral infection, and that should be treated. Most of the time, it is genital herpes.
Okay. Thank you so much for this brief answer, sir. So we are moving forward with next question. So the question is, what are the current treatment options and management strategies available for genital herpes, and how effective are antiviral therapies in controlling the infection, sir?
Yeah. So, genital herpes is treated by antiviral tablets. These are called as acyclovir, famciclovir. These tablets, when given in a proper dose, they can treat it. There are two types of herpes infection. One is a latent infection, one is a current infection. Latent means it is hiding there. For such kind of latent infection, we need to take treatment sometimes for 15 days, 1 month, even for 1 year also. I have treated patient for a single year also because he had a long-term latent infection. This particular long-term therapy helps them to control the infection. If we do not treat the herpes infection, then it can lead to other kind of sexually transmitted infections. Also, taking care of yourself by using protection like condoms, which will help you to revert back the infection or spreading the infection one person to other.
Okay, thank you so much for the answer, sir. And I can see is there is only one question is left. So the question is, what advice would you give to the general public about prevention, awareness, and the importance of regular health checkups to reduce the burden and stigma of sexually transmitted infections?
Yes. So for the general public, number one, you should have a single trusted partner for your sexual adventures. If you are having more than one partner, then you should get tested regularly. Secondly, if you or your partner are having multiple kind of infections or multiple partners, then we should go and confide it to your doctor who will counsel you. Counseling helps to understand your physical as well as sexual needs. We can understand what kind of infections you might have, and this particular infection can be treated. In lot of infections in the sexually transmitted part, can be controlled or treated at an early stage. If not, they will grow and turn into havocs, also to our public health. Also, lot of sexually transmitted infections are not in the public domain or in the public health sector, so that they are still underutilized and undertreated, like herpes simplex, which is generally ignored. Lot of people do not take care or do not get treated, and this definitely then spreads in infection like HIV or hepatitis or other kind of sexually transmitted infection, which can be stopped. Lot of the time, the young people who indulge themselves in sexual activities, they do not take any help or any guidance. I think these people should be led to some kind of sexual education where they would be guided what kind of partners, what kind of activities are beneficial and what are not, which would lead to decrease in sexually transmitted infection as well as having a good health in this young population.
Okay, thank you so much, sir, for these brief answers, sir. I hope you did justice with all the answers, sir. So I'm really thankful for this enlightening and much needed conversation, sir. You have beautifully explained not only the scientific facts, but genital herbs, but also the human side, the need for compassion, awareness, and open dialogue, sir. So, with all your permission, sir, I'm going to conclude this session, sir. Thank you. And to all our viewers, thank you for joining us this evening on Talks by IJCP. Remember, breaking the silence is the first step towards awareness and acceptance. Let's continue to spread knowledge, not stigma. This is Ada signing off. Stay informed, stay aware, and have a wonderful evening. Thank you so much, sir.
Thank you. Thank you very
Thank
much,
you.
Anand. Thank you, IGC.